Azad Moopen, Chairman and Managing Director of Aster DM Healthcare, gives us detailed performance of the Indian operation, his performance on how this quarter has gone by. Just to give a perspective, revenues up 8%, profit up 40%, EBITDA up 40%. Thank you, Mr. Moopen, for joining us on BloombergQuint. Can you give us details of the performance of the Indian operations? Which were the hospitals that performed, and which were the hospitals that showed weakness this time?
Yeah, so we have been very happy that some of our the new hospitals that we started, like in the one in Bangalore, in Kannur and all, has got ramped up very well. And so apart from that, individual hospitals we don't usually tell, but overall India has done very well. We have been having a very good revenue growth in India when compared to GCC. GCC was little muted. India hospitals and clinics have grown by 28%. And even the EBITDA, when you look at it, is 27%. So overall, the India performance, if you look at, has been quite good during this quarter.
Give us performance of, you already spoke briefly about the Gulf operations, but give us more details. What was the performance like?
Yeah. So the Gulf performance, what has been happening is that if you look at the hospital performance has been quite good. We have a 23% during this, the EBITDA, and 10% growth in the hospital, but 23% on the EBITDA. And there is a margin increase, which is quite significant, from 14.7% to 16.5%. So that is something which has really helped. And even if you look at the India hospital, the margin increase was not there, even though there has been an increase in the volume as well as in the EBITDA. So overall, when you look at in GCC, where we have the largest business, there has been an increase in the hospital, both volume as well as in the EBITDA and the margin. The one area which has a muted performance is the clinics, where there has been a muted growth as well as a muted increase in EBITDA percentage. So the primary care, which is the clinics and pharmacies, are not doing as well as the hospitals. This is the overall view of the GCC operations.
Okay, which are the hospitals that will break even this year?
Yeah, so hospitals which we started in Bangalore, which is a new hospital, the only hospital which we started during this financial year. We hope that it will break even towards the third quarter or early first quarter of next financial year. And the Kannur hospital, which we started early part of this financial year, has already gone into a break even. So we have been creating a break even. Somehow we have been able to produce break even within an year, or at least 18 months in many of our new hospitals in India.
What about the retail pharmacy and some of the clinics? That segment has probably not shown growth this time around. What are your expectations here, and what went wrong?
Yeah. So as you rightly mentioned, there has been muted growth in both these areas. This is because of the insurance rollout, which has been a positive thing by way of the increase in footfalls. But when you look at the actual revenue, it has not grown as well as the EBITDA. So there has been certain adjustments which have to be done, where the patients were coming into our larger brand, that's Aster, where we are now making it a point that they go into the Access clinic, and we have more of space for accepting the high-end patients into the Aster clinics. This is working well, and we hope that in the next 2 quarters, one by way of this reorganizing the way in which patients come to us, and second, most importantly, the cost efficiencies, which we are very, very aggressively looking at. There is a new software which is being implemented in the clinics, and that is going to produce significant impact on the speed in which this is happening, as well as overall the revenues, profits, as well as the margins.
So one of the key concerns that has been over the past few quarters, and I've spoken to you about this earlier also, is basically investors believe that the lack of free cash flow generation has been one bit of concern. How do you plan to address this?
Yeah, so this is a concern, and this is our topmost priority, that in the next 2 years, we want to reduce the debt by about 500 crores, which we are looking at ways in which, in fact, it has gone up slightly. We want to bring it down, and we want to give a 500 crores reduction in the debt. And as our EBITDA is going up, and there will be definitely free cash flow, and that is something which we hope that will help us to have more of free cash flow. And as our accumulated loss in India disappears in a year's time or so, we'll be able to provide dividend to our investors in the next 2 years. That's what we are hoping.
So what's the outlook for the fourth quarter and FY21 now?
Yeah, FY21 is usually a good quarter, like the third quarter. The first and second quarters are muted in GCC because 80% of our business comes from there. But the third quarter is usually, third and fourth quarters are the good quarters. So we hope that the same trend will continue. And we hope that we'll have fairly good revenues, EBITDAs, and the margin also may slightly improve. But what we have been very happy over the year, if you look at the year on year, we have crossed 10% of EBITDA margin, which was languishing below that for a long period. And the quarter has significantly gone up, and we hope that this will have an impact on our operations in the future. And the fourth quarter is as we planned, and we hope to hit whatever numbers we have in mind.
Okay, Mr. Moopen, we leave it at that. Thank you so much for speaking to BloombergQuint, and all the best for the quarters going ahead.